Namaste. Welcome you all for the yoga session. In this session, we are going to practice one of the standing postures which involves a fair amount of twisting of the trunk as well as an element of balance and stability. This posture is Parivritta Trikonasana. We are also going to add some intermediate postures so that the depth of this Parivritta Trikonasana can be felt better and the practice can become more holistic. Before that, we shall do some basic postures for the core muscles. Lie on your back, fold both the legs, heel closer to the hips, foot 6 inches apart, foot parallel to one another. Feel your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Feel also the posterior region of the lower back that also responds to the breathing. Watch your breathing. Chest should be reasonably stable, neutral. Watch the movement of the diaphragm. As we inhale, allow the abdominal cavity to expand throughout, all around, circumferential expansion of the abdominal and the pelvic cavity. As you exhale, it should contract. Towards the end of exhalation, try to contract the abdominal muscles little more than normal. This is a very fundamental breathing which has to be implemented throughout in all the postures. This breathing not only helps the abdominal muscles but also helps the mind to calm. Stretch both arms up. Breathe consciously. Neck at the center, chin towards the chest. Raise your right leg up. Straight the heel. Pull the kneecap. Toes towards the knee. Pull the kneecap. Tighten the quadriceps, the front of the thigh. Feel the stretch at the back of the thigh. Watch your hip. Watch the gluteal muscles or the muscles of the hip. Watch your back muscles. Press the left foot. For that you got to activate the calf muscle. Also contract the hamstring muscles against the calf muscle and feel the knee capsule. That is the outer covering of the knee on your left leg. Fold right leg down. Left leg up. Pull the kneecap. Stretch the heel. Consciously watch the muscles of the leg, especially the calf muscle, hamstring, then the muscles of the hip and also the lower back. Do not miss out on your breathing. Breathe at ease. Down. Right leg up. When raising the legs, also ensure that the base of the spine does not take off the floor. Pull the kneecap. Straight the heel. The muscles of the leg, especially the hamstring, they help the back a great deal. Right leg down, chain, left leg. Pull the kneecaps, stretch the heel. The hamstring muscles are connected to the hip bone, and on the hip bone sits the spinal column. So they are all involved in a kinetic or kinematic chain. The health of the hamstring is very crucial. So feel the stretch. Relax the left leg. Right leg up. Fold. Hold the right knee from both hands and pull the knee closer to the chest. And keep the foot, knee and the hip in the same plane. That is, do not move the knee out of the plane. And on both the legs, squeeze the hamstring muscles against the calf muscle and feel the inner corners of the knee. Also feel the outer covering of the knee capsule. Watch your breathing. Release right leg. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. This particular posture does help the gluteal minimus and the gluteal medius muscles. These are the two muscles in the region of the hip that greatly helps in all our walking. Pay attention to the breathing. That is the key. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg. Right leg up. Fold, hold the knee, press the knee closer to the chest. Stretch the heel, right heel, that is toes towards the knee. Do not neglect the left leg. You should press the left foot. For that you have to activate the calf muscle, then contract the back of the left thigh. Watch also the posterior skin, the thick skin resting on the floor. Release right leg. Chain. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. The posterior thick skin on your lower back, the thoracolumbar fascia as it is called, that also responds to breathing. Just watch that. It also experiences a mild stretch as you inhale and a contraction as you exhale. Get connected with the posture, get connected with the breathing, be present. Release left leg. Right leg up. Fold the knee from left hand, hold the ankle joint, pull it closer to the root of the left thigh. From right hand, push the knee. On both the legs, contract the hamstring muscles, the back of the thigh against the calf muscle, to enhance the feeling of the knee capsule. As we inhale, sensitize the base of the spine. Feel the base of the spine, especially the sacroiliac joint. That is the articulation between the iliac bone and the sacrum of the spine. Release the right leg. Change. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the knee. It's very important to have complete postural awareness. Do not allow the pelvis to rotate. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint, pull the heel closer to the root of the thigh. From right hand, push the knee. Activate the back of the thigh on both the legs. Breathe consciously. Feel the base of the spine. All these postures are designed to help the core muscles, which would include the region of the abdomen, the lower back, the hip, the pelvis, because this is the region which takes a lot of loading, and these postures prepare one to safely practice other postures. Release right leg, change left leg. Fold from right hand, hold the ankle joint, pull the heel closer to the root of the thigh. From left hand, push the knee. This posture also obviously helps the knee joint, the hip socket also gets a good soothing movement. The sacroiliac joint experiences a mild but very necessary movement. Good breathing is the foundation for all these postures. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it from right hand, push the knee across the chest. This is a very good stretch for the gluteal maximus muscle, which is one of the major muscles located in the region of the hip. Again, watch your breathing. As we inhale, the abdominal cavity should expand, as we exhale, it should contract. Release right leg. Left leg up. Fold from right hand, hold the ankle joint. Pull from left hand, push the knee across the chest. Press it closer to the trunk. Now here the abdominal muscles and organs also stand to benefit because of enhanced massaging movement under the pressure of the thigh. Do not neglect the right leg. Press the right foot. Tighten the calf muscle. Tighten the back of the thigh. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel also the lower back. No muscle acts in isolation. They're all connected in a great kinematic linkage. So that is why all these varied movements are essential to keep this whole chain of movements healthy. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. You must do these postures with awareness. Mechanical movements does not yield great results. The movement should be done with awareness. You must be present. You must get completely involved. Release left leg. Watch your breathing. Right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the right heel. Now lift the left foot, keeping the heel on the ground, then slowly sliding the heel, straighten the left leg. Pull the kneecap. Push the knee as close to the ground as possible, while you draw the right knee as close to the chest as possible. So right hip is going towards a strong flexion, while the left hip is going to a neutral position. In effect, this is a very good movement for the back muscles. Slowly fold your left leg, taking the heel closer to the hip. Release right leg. Chain, left leg up, fold, hold the knee, press the knee closer to the chest, but completely pull the knee. Keep the left heel active, toes toward the knee. Then slowly slide the right foot, keep the heel in contact and gently slide, straightening the right leg. Right heel also have to straighten, toes towards the knee, pull the kneecap, charge the thigh as close to the ground as possible. Feel the region of the tailbone. Breathe well. All these movements are very useful, especially in the beginning. Slowly fold your right leg, release left leg. Right leg up, fold, hold the knee, press the knee towards the chest. It's also important to repeat these postures. Then slowly slide your left leg forward, straightening the left leg. When you do that, ensure that you maintain the line and length of the left leg. That is, you should not deviate the axis of the left leg. Watch your breathing. Feel the hips, feel the thigh, feel the lower back. Slowly fold left leg, taking the heel closer to the hip, then release right leg. Chain, left leg up, fold, hold the knee, press the knee closer to the chest, stretch the heel, gently slide the right foot, keep the heel in contact with the ground, raise the foot, then stretch right leg. Pull the kneecap. Feel the pelvic cavity also as we inhale and exhale. So these movements prepare the core muscles for further action so that they become very safe to practice. Slowly flex the right leg, then release left leg. Be attentive. Right leg up, fold, rest the right ankle just below the left knee, rise the left leg from both the hands, clasp the left thigh, pull closer to the chest. Also move the right knee slightly away from the trunk. Feel the region of the hip. You must feel the deeper muscles in the hip. Keep both the heels active. Slowly bring the left foot down. Take the right leg down. Chain, left leg up, fold, keep the ankle slightly below the knee, rise the right leg, clasp the thigh from both hands and pull closer to the trunk. Both the heels active, toes towards the knee, which means the calf muscle gets a good stretch. Do not lose track of the breath. Release right leg. Release right leg. Left leg also down. One more time. Right leg up, fold, ankle joint just below the left knee, stretch the heel, rise the left thigh. Now from left hand hold the left thigh, pull from right hand to push the right knee. Now you can feel enhanced stretch deep in your right hip. You are stretching one of the important muscles, the piriformis muscle, the deeper muscle in the hip, which happens to be very close to the sciatic nerve. Release the legs, right leg also down. Chain, left leg up, Hold ankle just below the knee. Rise your right leg with knee flexed. From right hand, pull the right thigh. From left hand, push the left knee. Keep the heels active. So all these postures rejuvenate the muscles in and around the lower back, hip, pelvis. The hip joint also gets a very rejuvenating movement. Knee and ankle also become active. Release the right leg, left leg also down. These set of movements help one to prepare in a safe way for doing other postures. Rise both legs up, fold the knee, hold the knee, press the knee gently towards the chest. Breathe well. Even here, stretch the heel and tighten the hamstrings against the calf muscle. You must make the posture as effective as possible. Also watch your breathing. Watch the posterior region, that is the thick skin resting on the mat, especially the lower back and the lower part of the upper back. That's where the thick skin, the thoracolumbar fascia, is spread. Just watch. And tightening the hamstrings helps the knee capsule a great deal. Stretching the heel helps your ankle joint, the arch of the foot, the intricate muscles, ligaments and joints in the foot also. Do not neglect the muscles of the forearm and upper arms. That also you should actively engage. And of course, you've got to breathe consciously. So when you do all this, your mind cannot oscillate. It will be in the posture. That is when the posture becomes a yoga asana. Release the legs. Feel the breathing. Stretch your left leg forward. Roll onto the right side. Press the left palm. Slowly get up. So these are some of the basic postures that greatly helps one to relax the most taxed portion of our system. Sit upright. Sit on your heel, knee to rest on the folded blanket. Kneel down. Take your right leg forward, bent at 90 degrees. Both hands on the waistline. Inhale, exhale. Flex the right knee. Stamp the right foot firmly. Ensure that the right and the left thigh are parallel to one another. That they should not deviate from their normal position. Chest and navel up. This is a good posture to bring the lumbopelvic hip complex, as we call, that is the lower back, hip and the pelvis region, into good action. Tighten the right hamstring. Slowly come up, take the right leg back, then chain. Left leg forward, bent at 90 degrees, chest and navel up. Inhale, exhale, flex the left knee. Strike the right foot, tighten the right calf muscle, feel the right hip and the left hip being in flexion, right hip in extension. You should feel. So this is a good stretch for the hip flexors. This also helps the thigh and the hip. Also helps to orient the back muscles properly. Slowly come up, take the left leg back. Fold the blanket a little thicker. Then sit in Swastikasana. We are going to introduce twisting also. Inhale, exhale, turn to your right side, left wrist to the right knee, right hand fingertips on the floor, turn. Because in Parivritta Trikonasana, the twisting of the trunk is very important. So, using these postures of twist would definitely enhance the feel of Parivritta Trikonasana. Chest and navel up. Breathe well. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Slowly come up. Then change side. Inhale, exhale, turn. Right hand on left knee, left hand fingertips on the floor. Turn. Keep the shoulders even. Chest and navel up. Press the left hand fingertips as far back as possible and keep on twisting the trunk. Do not hold the breath. Inhale, abdominal cavity should expand. Exhale, it should contract. Slowly come up. Get up, spread the blanket, knee on the blanket. Sit on your heel, chest and navel up. We are going to Parivritta Trikonasana. Take your right leg forward, bent at 90 degrees. Right leg bent at 90 degrees. Now twist the trunk, bend forward, keep left hand fingertips by the side of the right heel, right hand on the waistline. Now straighten both the legs. Twist the trunk, roll the right shoulder back, watch your left leg, press the outer edge of the left foot, left heel, right heel as though they are one by the side of the other. Look up. By turning the neck, you should look up. Twist the trunk. Keep on pulling the kneecap. Now flex the left leg and right leg. Slowly come back. Take your right leg back. Take your left leg forward. Left leg bent at 90 degrees. Now bend forward. Keep the right hand fingertips in front of the left ankle joint, straighten the right leg, turn the right foot as much in as possible, left hand on the waistline, both legs straight and twist the trunk. Keep on pulling the kneecaps. Push the root of the left thigh down. Even pressure on the inner and outer ankle on your left foot. Twist the trunk nicely. Now flex the knees, come down, take left leg back, sit on your heel. So Parivritta Trikonasana involves a good load bearing for the lower extremities, a twisting of the trunk is involved, and because of the positional geometry, you also need a good amount of balance. Now go to Chatushpadasana. Keep both the fingertips on the floor. Take your right leg back. Take right leg forward. Right leg slightly bent. Stretch the toes. Press the heel down and pull it closer to you. Chest and navel up. Feel the back of the thigh, the hamstring muscles. In this posture, we are trying to intensify the stretch on the hamstring muscles. Initially, you should keep the right leg slightly bent, then slowly, gently straighten the right leg, pull the kneecap, straighten the quadriceps, but chest and navel up. Feel the back of the right thigh. Hamstring muscles play a crucial role in all the standing postures. So that is how this intermediate posture is very useful to make the posture better, to feel the posture better, to get absorbed in the posture. Take your right leg back. Change. Left leg forward. The foot should go slightly beyond the arms. Press the left heel on the mat, stretch the toes towards the knee and pull the heel towards you without allowing it to slide so that the hamstring automatically gets into action. Chest and navel up. Slowly straighten the left leg, pull the kneecap, straighten the quadriceps, top of the thigh and look up. So this is very good for the hamstrings and the gluteal region. Take left leg back, sit on your heel. Standing postures, they do help almost all major muscles of our system. Now fold the blanket a little thicker. We are going to add one more twisting posture. Sit upright in the cross-legged posture, sit upright, inhale, exhale, turn to your right side. From left hand, lock the right knee, right hand fingertips on the floor, keep on turning. With every inhalation, it is as if you are stretching the trunk up, and with every exhalation, you are twisting it more. Turn the neck also in the direction of the twist, breathe well. And the twisting of the trunk essentially helps in the health of the intestinal organs as well as the organs in the pelvis, the urogenital system, the digestive excretory system, they all get greatly rejuvenated in any good twisting movement. And you should use your breathing properly. Slowly come up, then change side. Inhale, exhale, turn to your left side. Right hand on left knee, left hand fingertips on the floor, inhale, exhale, twist. Turn the neck also in the direction of the twist. Chest and navel up. Parivritta Trikonasana involves twisting of the trunk. Therefore, doing these twisting postures would greatly enhance the quality of the posture. In Parivritta Trikonasana, the pelvis can be felt better because of the position of the legs. So Parivritta Trikonasana not only strengthens the leg and the trunk, but also helps in removing the toxins. Slowly come up as you inhale. And spread the blanket, knee on the blanket, sit upright on your heel. So remember the feel at the hamstrings. Kneel down, take your right leg forward at 90 degrees. Use the twisting of the trunk. Twist the trunk. Keep left hand fingertips in front of the right ankle joint, right hand on the waistline. Straighten the left leg, inhale, exhale, turn. Both the heels should be as though they are one by the side of the other. Twist the trunk, stretch the trunk. Turn the neck and look up. Breathe well. Feel the pelvis, feel the abdominal region. Flex the knee, slowly come down. Take your right leg back. Change side, left leg forward at 90 degrees. Twist the trunk. Keep the right hand fingertips by the side of the left ankle. Then straighten the right leg. Left hand on the waistline. Turn. Push the root of the left thigh down. Turn the right foot as much in as possible. So you got to twist the trunk and stretch the trunk, and do not allow the right shoulder to move away. To the best possible extent, you should bring the trunk and legs to the same plane. Slowly flex the knee, come down, take your left leg back, sit on your heel. Sit upright. Line your chest. We are going to do simple backward bend. Rest the forehead. Keep both the palm by the side of the forehead, middle finger pointing forward. Stretch the toes, squeeze the calf muscle. Press the palm. Note the position just by the side of the forehead. Inhale, exhale, straighten the arms, well open the chest. Then stretch the neck, look up. A good hyperextension of the spinal column, including the cervical spine. Feel the region of the throat. Keep the legs active. Calf muscles are very important. Thigh, gluteal region. Keep the upper arms also active. Press the palm. Feel the pressure between the palm and the mat. Breathe well. Do not hold the breath. Flex the arms. Slowly come down. backward bend can be further intensified. Keep the palm below the shoulders, middle finger pointing forward, press the palm, elbows closer to the trunk. Inhale, exhale, stretch the arms, open the shoulders, tighten the muscles of the upper arm, well open the chest, look up, stretch the toes, squeeze the calf muscle, tighten the buttocks. The backward bends should enhance your feel for the muscles and organs of the trunk, should get you better feel for the complete paraspinal muscles, should make you feel more mobile or flexible. Flex the arms, slowly come down. Keep both the palms by the side of the chest, middle finger pointing forward, elbows closer, press the palm. Inhale, exhale, rise the trunk, stretch the arms, open the shoulders, lift the neck up the clavicle, bend the cervical spine and look up. Feel the pressure between the palm and the mat. Minimize the gap between the palm and the mat. Slowly flex the elbows, come down. So backward bends, twisting, and then Parivritta Trikonasana will greatly help all major muscles and organs in the trunk. Slowly get up. Fold the blanket, sit upright on the blanket in the cross-legged posture, hips on the blanket, chest and navel up. Inhale, exhale, turn to your right side, left hand on right knee, right hand fingertips on the floor and turn maximum. Breathe well. So intensify the twisting with every exhalation so that the Parivritta Trikonasana can be performed better. You can get a better grip over the posture. So this sequence is designed so that the posture becomes better, more refined, more effective. Slowly come up. Change side. Right hand on left knee, left hand fingertips on the floor, inhale, exhale, turn. Turn the neck also in the direction of the twist. Watch your breathing. As we inhale, abdominal cavity should expand. As we exhale, should contract. Try to feel even the pelvic cavity as you stretch, twist and breathe. Slowly come up, sit upright, stand up in Tadasana, join the heel, join the big toe, pull both the kneecaps, both hands on the waistline. Now we shall do Parivritta Trikonasana starting from Tadasana. And exhale, jump 4 to 4.5 foot apart, foot parallel, right foot 90 degrees out, left foot as far in as possible, but position the heels so that they are just on the opposite side of one another, both hands on the waistline. Inhale, exhale, twist and turn the trunk. Take your left hand down, left hand fingertips on the floor in front of the or by the side of the right ankle, left hand on the waistline. Twist the trunk nicely, chest and navel up. You have to push the right shoulder back and left shoulder in so that you align the trunk and legs in the same plane. Also turn the neck, look up, both legs straight. Inhale, come up. Left hand on the waistline. Change side. Left foot 90 degrees out, right foot in. Turn the right foot. Press the outer edge of the right foot. Both legs straight. Very important to be strong on the legs. Inhale, exhale, twist the trunk. Bend. Right hand fingertips on the floor by the side of the left ankle. Left hand on the waistline. Inhale, exhale, twist the trunk. You should stretch the trunk and also twist. Keep both legs straight. Push the root of the left thigh down. Feel the complete spinal muscles. Feel the length and breadth of the spinal column. Slowly come up. Right hand on waistline, foot parallel. Inhale, exhale, jump Tadasana. Keep the folded blanket to do Virasana. Both legs folded sideways, hips on the blanket. Clasp the fingers. Inhale, exhale. Stretch both arms up. Face of the palm to be opened upwards. Stretch the arms strongly, intensely, and push the palms slightly back so that you can get a better stretch for your armpits. Activate the muscles of the upper arm, forearm. And sitting in Virasana like this would also help to remove the fatigue in the legs. Flex the arms. Take the legs forward, cross the legs. And then inhale, exhale, turn to your right side. Turn well, twist the trunk completely. Intensify the twist. Inhale, come up, then change side. So this sequence is designed so that gradually in a graded way you move deeper into Parivritta. Chest and navel up. Slowly come up. Stand up in Tadasana. Join the heel, join the big toe, pull both the kneecaps, stretch both arms downwards, squeeze the buttocks, chest and navel up, look forward. Inhale, exhale, jump 4 to 4.5 feet apart. Simultaneously stretch the arms sideways, arms parallel to the floor. Right leg 90 degrees out, left foot inside, heel as the one by the side of the other. Stretch both arms. Ensure that the shoulder blades are closer to one another. Exhale, turn and bend, taking the left hand fingertips by the side of the right ankle and rise your right hand in line with the left hand. Parivritta Trikonasana, both legs straight, both arms straight. So you should twist the trunk, stretch the trunk so that the arms, trunk and legs almost are in the same plane. Slowly come up as you inhale, change side, left foot 90 degrees out, right foot inside, stretch the arms, inhale, exhale, turn and twist the trunk, bend, take the right hand fingertips to the side of the left ankle as you rise your left hand up in line with the right arm and look up. Turn the cervical spine and look up at your left palm. Parivritta Trikonasana. Be strong on both the legs. Create good space and freedom at the pelvis and abdomen. Twist well, stretch well, breathe well. As we inhale, slowly come up, foot parallel, keep the arm stretched, inhale, exhale, jump, Tadasana. Join the heel, join the big toe and be seated in the cross-legged posture, the Swastikasana on the folded blanket. Sit upright, watch your breathing. This Parivritta Trikonasana is an excellent standing posture which combines strength of the lower extremities with balance and good twisting of the trunk. This is very good for not only the lower extremities but also the complete back, and also helps to rejuvenate the intestinal muscles and organs. Namaste.